Good morning, everyone. We're going to give it a few minutes before we go ahead and get started. Thank you for joining us today.
Yes, yeah. I can't hear, honey. Cook. What the? Yeah, there. I think that's worse.
Good morning. We'll get started here in a few minutes.
Oh, there. Indoor.
All righty. Thank you, everyone, for joining us today for the food safety training. We'll go ahead and get started and introduce our presenters.
Hi, good morning. Welcome, everybody. My name is Kelly Boycourt, and I'm the Senior Manager of Food Sourcing. I'll be presenting today alongside Sarah.
Yes, good morning. I'm Sarah. I'm the Food Rescue Manager and excited to talk to you all about food safety today.
Whoops. Good morning. I'm Christy. I'm the Food Rescue Coordinator.
Hi, everyone. I'm Miriam Sullivan, and I'm the Partner Services Coordinator.
Perfect. I will go ahead and get started with some housekeeping. Just a reminder, our microphones will be disabled during microphones will be disabled during the presentation, but turned on for the Q&A portion. Please utilize the chat function for any questions throughout. We will check them and answer them towards the end, and this webinar will be recorded and shared afterwards. And then just a reminder, your chat feature is located right here in that top bar. Without further ado, I am going to go ahead and pass it off to Kelly to talk about the importance of food safety.
Hey, thank you. Good morning, everyone. So yeah, here's a brief overview of the kind of major topics that we're going to cover in this food training. Definitely not an all-inclusive list, but these are some really good topics for those of us, as everyone here is, that are involved in nonprofit food operations. And so first up, we have the importance of food safety. So, why are we here and why is this training being hosted? So, as I mentioned before, the SLO Food Bank is working alongside a network of community partners, which many of whom are represented here of our agency partners, to alleviate hunger in San Luis Obispo County and build a healthier community. Through these efforts, we are collectively serving over 45,000 people each month right now, which is a lot of people. And so this is amazing work that we do, but it is very important to continuously keep food safety at the forefront of our minds to ensure we are serving these thousands of neighbors safely and with dignity and care. We are also working together as a network, and should someone contract a foodborne illness from a distribution, a pantry, or a meal site within our network, our entire network and programs will be under closer scrutiny. And of course, we would want to find out why it happened in order to prevent anyone from becoming sick again. So it's just really important that we all keep our food safety practices and training in our daily and weekly routines, as well as long-term planning to ensure we can continue our shared mission, alleviate hunger with dignity and care. And that's kind of something I'd like everyone to keep in mind as we go through the presentation is, in our network when we're serving people, these are some higher risk populations, and some of the people we serve may not have as ready access to healthcare or childcare or time off work should they become ill from a foodborne illness. And so practicing food safety is really a way that we can show care and dignity to everybody that we're serving. I also want to talk a little bit about where our guidance and food safety rules come from. Believe it or not, it's not just the SLO Food Bank making up food safety rules. We are getting our guidance from some other really valuable entities and resources. So on the left-hand side, you'll see this graphic that's kind of explaining where some of our larger food safety guidance comes from. You may have seen this little chart in previous food safety presentations we've done, but it really starts at the federal level with the Food and Drug Administration food code, and then that helps inform these different state retail food codes. So being in California, the California Retail Food Code is also really important. And then that trickles down to the more local level with the County Environmental Health Department, which is our entity in this county that's responsible for overseeing public food operations. Additionally, the SLO Food Bank is a member of Feeding America, which is a national organization forming a network of food banks. Feeding America gets a lot of guidance through the Food and Drug Administration Code that they then help provide materials and guidance for programs ran at Feeding America food banks, including the agency partner program that you were all a part of. So all of these items are kind of working together to ensure at every level of the organization, like food safety is important. And then I also briefly wanted to mention two relevant laws that nonprofit organizations serving food to the public should be aware of, and that's the Bill Emerson Good Samaritan Food Donation Act, as well as the Limited Services Charitable Feeding Operation. And I'm going to do kind of a brief Spark Notes, but we will include in the webinar follow-up some information online where you can go read more about these. But the Bill Emerson Act helps protect donors from liability when they donate food in good faith. So this is kind of protecting the donor side, saying, if you're donating food that you believe to the best of your ability is safe to consume, it kind of releases the donor from liability. So hopefully that helps, our nonprofits gather more food donations from the public so people aren't in fear of liability should they donate something that maybe later down the line causes an issue. The other end of that is the Limited Services Charitable Feeding Operation Bill. Part of this bill exempted charitable feeding operations. So all of our agency partners are nonprofits serving food, so they are a charitable feeding operation. So it exempts a lot of our nonprofit partners from the definition of a food facility. What this means is that when you start a pantry at a church, for example, as an agency partner, you don't have to have county environmental health come in and inspect the room that you're intending to store food in. And it doesn't have to be to the level of restaurant service or production service in terms of like plastic walls or the baseboard siding. It kind of acknowledged that nonprofits can safely serve food in non-commercial food facilities, essentially, so like what we do, but it still means that nonprofits have to follow general food safety requirements. It was just meant to kind of alleviate some of the boundaries in trying to get a fully licensed food facility. One thing about this bill, though, is if you are serving meals to the public, you do still need a food facility license if you're serving meals to the general public, but everything else can be exempted from that. And then I also wanted to orient everyone briefly to the 3 types of food safety training that you may hear us mention or have heard mentioned in previous webinars. And I'll go over the specifics of what is required for each agency partner on the next slide. First, we have the California Food Handler Certificate. This is always an option to be food safety certified. We recommend you take it online through ServSafe. It's good for 3 years and it costs about $10 a person. And we'll include information on that. So right now, there's one agency partner representative, usually the site lead, who carries this license. And it's also still an alternative for any of your volunteers who are doing food rescue or who want to be food safety certified. It's open to the public. And then if you're serving meals, you'll have the food protection manager. So that's like the elevated level, also offered through ServSafe or in person. This is good for 5 years and costs a little bit more because it's more in depth about meal preparation and specific food safety items related to that. And then newly, what we're doing now is the food bank equivalent or SLO Food Bank training. So this is new. It'll be good for 1 year. We hope that it would be an annual occurrence that people would take this training, and trying to keep it accessible and free to all agency partners to help folks access it. It'll be either video recordings, such as this one that we're doing, or we'll update them and make them available to agency partners. And we may in the future even investigate in-person options for food safety training if that would help our partners make sure all their volunteers are trained. So who needs to be food safety trained? So a big update that we're working towards is that all volunteers and staff participating in agency direct rescue, so that would be picking up, transporting, and handling retail food donations from grocery stores or school districts, which I think a majority of our partners are participating in. So any of those volunteers that are responsible for picking up and transporting and handling those food donations are now required to either have this training that we're doing right now or the ServSafe California Food Handlers license. So that is a new requirement that we're hoping this food training will help our agency partner volunteers reach. And then, as I mentioned before, we've always required the lead volunteer or staff member of an agency partner to have the ServSafe Food Handler Certificate. And now, should someone choose, this training could also be fulfill that requirement. And then for all volunteers and staff handling food, we strongly encourage, anyone who is regularly handling food, especially temperature sensitive food for your agency, to have some sort of food safety training. So that could be them watching this recorded webinar. They could take the food handler certificate, be good for 3 years, or your agency could implement maybe a food safety training program that you make sure all volunteers hear, which is something the food bank does. And then, as I mentioned before, if you are preparing meals, that's when you need to have one person at the higher level of the food protection manager. And that person should be the person who is overseeing the meals, that is regularly overseeing the meal preparation that your agency is doing. And then I think it's going to go back to Natalie.
Thank you, Kelly. Yeah, so I am going to talk about the certification. So when you take your ServSafe, you do receive a certification. And so for bank portion of ours equivalent, we have created this self-certification document along with a log to document who has been trained for your purposes of record keeping to keep in-house. And following this webinar, you will receive these documents and you guys will be able to fill them out, writing that you completed this training with us today, and then keep it with your agency. I would have the main contact keep one log with everyone's information, and they will have that for safekeeping, and then we will review it or keep notice and contact for to see the record keeping of it, to see who's been trained. Following that, I am going to go ahead and pass it off to Sarah.
Awesome. Thank you, Natalie. And yeah, hi everyone, I'm Sarah. And yeah, now it's time to talk about biological, chemical, and physical hazards. So there we go. So just as an overview, chemical hazards involve substances that can cause harm through exposure, while physical hazards are external forces or objects that can cause injury. And biological hazards are living organisms or their byproducts that can cause illness or disease. And really the most important thing to remember when it comes to any of these hazards is to prevent, prevent, prevent. So let's break down what each type of these hazards entails, so you can be best prepared to avoid them at your organizations. So chemical hazards include products we need to keep areas clean and sanitized, like sanitizing wipes and sprays, window, floor, and bathroom cleaners, and industrial chemicals like bleach. They can also include products that you may keep in your cars, like coolant or oil, or even overhead from your facility, like dripping AC units, plumbing, or roofing. So avoiding these chemical hazards and food safety is really crucial for protecting public health and ensuring a safe food supply. These hazards can cause a range of health issues, from immediate foodborne illnesses to long-term chronic diseases. And so physical hazards include foreign objects unintentionally present in food that can cause injury or illness if consumed. These are not naturally part of the food, but they're introduced either during production, processing, or handling. Some examples include glass, metal fragments, plastic, stones, wood, bones, hair, bandages, or even little pieces of packaging that might get into it. These physical hazards can be introduced by transportation in inclement weather, or even by just distributions taking place outside. And they can lead to injuries like cuts, choking, tooth damage. And it's really important to keep food covered and contained when exposed to the elements for these reasons. And we'll dive deeper into other ways to prevent some of these physical hazards in just a bit. And then biological hazards refer to living organisms or their toxins that can contaminate food and cause foodborne illnesses. And so these include bacteria like Salmonella, E. coli, Listeria, viruses like norovirus, parasites like Giardia, and fungi like mold and certain yeasts. And it's important to note that contamination can occur at any point of food processing, from the farm to the table. And it's really important to inspect your raw ingredients, like fresh produce or meat, for any signs of contamination or contact with animals. Fresh produce is especially susceptible, and it can be contaminated through the soil, irrigation water, and all the other sources along the way, posing a significant risk if consumed without proper washing or cooking. So really be sure to thoroughly inspect any fresh produce donations that your organization may receive, and encourage your clients to always wash the produce before consuming it. And again, the most important thing to remember when it comes to any of these hazards is to prevent, prevent, prevent. Once an item has been contaminated, it must be discarded because it's no longer safe to consume. And just remember to always check for signs of poor storage from donated food, as this may indicate that it's been contaminated with one of these hazards. Reputable vendors are trained in food safety and proper handling and storage. However, it never hurts to be extra cautious when receiving your donations, especially the raw items like fresh produce and meat. And then in the following slides, we'll go over some other ways to avoid these hazards, including personal hygiene, proper food handling, transporting, sorting, and cleaning. But next up, Kelly will talk about personal hygiene.
Hey, thank you, Sarah. Yes, that transitions great into our next topic, which is personal hygiene. This is a bigger section, so thanks for bearing with me. But it's so important, as Sarah said, to help prevent against many biological, chemical, and physical hazards, and is one of the easiest ways that we can ensure that we're practicing food safety with just a couple simple routines that you can implement in your pantry with your volunteers and staff. So first up, again, I mentioned it sounds simple. It really is. You've probably heard this before and you'll probably hear it again, but hand washing is one of the most important parts of personal hygiene when you are working with food that you're serving to other people. So it's simple, but it is so, so important. Improper food handling, such as improper hand washing, is a leading cause of foodborne illness in the United States. And so it's just really important that you ensure that your food operation is regularly practicing this and that you're reminding volunteers and staff and being really thorough with it. So a couple tips are to follow the main hand washing steps. You can look up one of these charts online and post it by your hand washing sink or things like that. But really important to make sure that you're taking your time and make sure that you always wet your hands, apply soap, and sing the happy birthday song or whatever it is you want to do to make sure you're scrubbing your hands for at least 20 seconds. Rinsing your hands thoroughly, because again, soap could be a chemical hazard if it's left on your hands and you take sudsy hands to go touch food. That's not good. So make sure you rinse that all away. Ideally, turn off the faucet with a paper towel at your elbow and then dry your hands with a clean paper towel or hand towel. You should never dry your hands on your clothes, apron, or again, clothing. So that's just important to make sure you're using the proper devices. So up next, we're going to have a little pop quiz. So if you want to pull up the chat bar and put what you think the answer is in the chat, please feel free to do so, or just think to yourself to see if you get it correct. So after which activity should you wash your hands? Is it A, using the restroom, B, sneezing, coughing, or using a tissue, C, leaving and returning to the food handling area, D, before putting on gloves at the start of a new task, or E, all of the above? Give everyone a couple seconds. Ooh, I see one answer looking pretty good if you want. Perfect. Everyone's getting it. So it is E, all of the above. These are all instances when you should wash your hands and when you should instruct your volunteers and staff to wash their hands in your food facility as well. There could truly be an endless list of which activities to wash your hands after, such as handling cleaning chemicals, after eating and drinking, chewing gum, after using tobacco products, after taking out the garbage, and more. So the best practice overall is to encourage frequent and vigorous hand washing. Agency partner representatives should wash their hands always before handling food, no matter what activity you were doing beforehand. For example, no one should ever walk into your agency's food program area and just begin handling food without first washing their hands. Agency partner site leads should be sure to lead the food safety cause and instruct volunteers and staff and remind them to wash their hands before getting to work. The more that everybody is buying in and practicing these food safety practices, the more that it becomes the behaviors and culture of your food program. And that's really when it becomes much easier, because it just becomes second nature for anyone coming into your food pantry to rise to that level of food safety. Other best practices for personal hygiene at your food pantry or meal site. Ideally, if possible, you would have a specific sink designated for hand washing that is not in a bathroom. So if your facility does have spot for a sink that's not in the restroom, that could be like a hand washing sink for your food program, that's great. But I understand that's not possible for everyone because we're working with limited spaces. So when it's possible, that's awesome. If it's not possible, just make sure that that sink in the restroom is nice and clean and well maintained, and that it has all the necessary supplies that you need. So make sure it's stocked with soap, paper towels, and a trash can. The trash can is important so somebody doesn't take those paper towels that they use to dry their hands on, put it in their pocket, and then they lean over a food bin, and then now dirty paper towels are ending up in like a box of apples. We don't want that. So it's important to make sure you have just those simple items ready so people can successfully practice good hygiene. Make sure your hand washing sink has hot water. Sometimes some facilities, especially if they're in an older building, the hot water might take a long time to kick on, especially during the winter. So if you're the first person into your food pantry, maybe get the hot water going so that when all your volunteers come in, the hot water is just ready to go. And that'll help ensure everybody's practicing good hand washing. And then do please have a hand washing sign posted by your designated sink reminding people to wash your hands before going back to work, wash your hands before handling food, or reminding people on the steps. And again, there are a lot of different versions of a hand washing sign that you can easily look up online and just print out. The other thing I wanted to talk about is proper glove use. So we do require agency partners to wear gloves when they're handling raw produce, which I'll talk a little bit more about. It's also just good practice to wear gloves when you're handling food in general. It's a nice added layer of protection if you are practicing proper glove use. So always wash your hands before putting on gloves. Again, wearing gloves does not replace hand washing, but is a good second step to help protect after you wash your hands. So you should always wash your hands before putting on gloves. Similarly, you should frequently change gloves and rewash your hands after. So every time you change gloves, you should also be washing your hands. They are a twofold package. And so you should change gloves and rewash your hands after handling raw meat, seafood, ready to eat food, poultry, especially if you're switching between those categories. So if you are bagging raw produce into a mixed produce bag, and then you're going to go touch raw meat, you're going to wash your hands in between and then move on to the other task. This is especially important if you're handling raw meat or seafood or a major allergen, and then you then switch to a task that's using ready to eat food. Because if you don't properly wash your hands, you might carry contaminants or foodborne illness from that raw meat, for example. If like a ground beef package was leaking a little bit and you're wearing the same gloves that you use to handle the raw meat and then go touch produce, you've now contaminated your produce with raw meat. So it's really important to be vigorously hand washing and changing your gloves between each task, as well as if you are interrupted and take a phone call. Phones are dirty places, unfortunately. They go everywhere with us, and so they get germs from everywhere. And then before beginning a new task, handling a known allergen, and then also as your gloves, if they tear or become dirty, it's time to change them. That is why we use single-use disposable gloves, which leads into my next bullet point. We should always be using single-use gloves, not like reusable gloves, which would be like rubber kitchen gloves or gloves like if your hands get cold and you're wearing cotton gloves. Those are not acceptable food handling gloves. They should be single-use, food-safe gloves that you can change frequently between tasks. And then kind of on that same note, they're meant to be used once and disposed of. Gloves are not meant to be rinsed, washed, or reused in any way. So once you go to change them, they should just be disposed of in a proper trash receptacle and not rinsed off and washed, because there's just pockets in the gloves that might accumulate contaminants and they're not meant to be used in that way. Okay, so we have another pop quiz question. So why do we wear gloves when handling whole raw produce, such as apples or oranges or potatoes? Is it A, the produce is dirty from being harvested from outside? Is it B, to protect from major allergens? Or is it C, because produce is a ready-to-eat food and might be consumed without cooking or washing? Yay, good job seeing some answers. You're right. The answer is C. So we really want people to wear gloves when handling produce, because while it might be in my regular practice to wash all my produce at home, if you distribute a ready to eat piece of produce like an apple, somebody might just immediately eat it. And so we really want to make sure it's not contaminated with something that can hurt them. There really aren't a lot of produce types that are a major allergen unless they're mixed with something else. So although gloves can help prevent cross-contamination from allergens, it's not the most applicable to produce. And then while the produce might be a little dusty or dirty from being harvested from outside, that is why we encourage people to wash it. But the main reason to wear gloves is because it's a ready-to-eat food. And we don't know if everybody's going to cook their produce or wash their produce before eating it, so we're just trying to be extra safe. I think one of my last slides about personal hygiene, just a couple other things that are pretty common. Just keep an eye on, again, you're touching food with your hands mainly, so it's best to keep fingernails short and clean when possible. Just keep in mind that if you have longer fingernails, they can be harder to clean, especially underneath the nails. So that's something to be extra thorough with in your hand washing if you are like me and like longer nails. If you're handling exposed food and you have nail polish or false fingernails, you should always be wearing gloves, because the nail polish can flake off into food, posing a physical contaminant hazard. So if you do have nails or nail polish, wearing gloves is a great way to ensure that you're not accidentally having contaminants get into your food. So I know this might seem like a lot at once, but I promise it is easy to implement. The SLO Food Bank has a volunteer orientation at the beginning of every shift, which we do at minimum 2 shifts a day in our warehouse, 5 days a week. And so 10 times a week, we're giving a volunteer orientation. It takes no more than 15 minutes. Even if somebody has volunteered with us 10 times, they're going to hear the spiel again. And so we just talk about food safety, proper hand washing. We also do some other safety logistics for our facility, which is nice, just letting folks know to keep an eye out for forklifts. And you might have areas in your pantry you want to touch on as well. And then our staff then leads all the volunteers to the hand washing station together to immediately put down our belongings and wash our hands. And even the staff leading the volunteers will be in line to wash their hands. So it's helped fostering that food safety forward environment. So the more you practice implementing and focusing on food safety, the easier it is and the safer our community will be. Another great thing you can do, and you can make one specific to your agency, is a simple checklist ahead of time that every volunteer checks before they start volunteering with your food program. And it can, include, are you wearing the proper attire for the program? Did you wash your hair? And things like that. And so you can look some up online. There's a lot of different options. And then you can always add to it as you figure out more things that you want your volunteers and staff to be aware of. Woo, okay. So we've covered the bigger section of personal hygiene. And so I'm going to pass it on over to Sarah to talk about major allergen control.
Thank you, Kelly. So, yeah, let's get into allergen control. Allergen control and food safety is a critical process to prevent allergic reactions and ensure the safety of consumers, especially those with food allergies. So it involves identifying, controlling, and preventing cross-contamination of allergens. And this topic is extremely important because major allergens can be deadly. And this is why nutrition labels and general allergy warnings are absolutely essential when feeding the public. All right, and so quiz time again. Do you know how many major allergens exist according to the FDA? Bonus points if you can name some of them. Feel free to type it in the chat. Cool. Well, no worries if you don't know, folks. We are here to teach you. There are 9, there we go, nuts, yes. There are 9 major allergens according to the FDA. And these include milk, eggs, fish, crustaceans, shellfish, tree nuts, peanuts, wheat, soybeans, and sesame. And sesame was recently added to the list of major allergens just a couple of years ago. And so our food rescue team has general disclaimer posters for your organization to use, as well as prepared food labels for schools to use when donating to you. Since we don't know who might be allergic while serving the public, it's really important to share that none of us have allergen-free facilities. These general disclaimers and nutrition labels provide our clients with the crucial information they need to stay safe and healthy when picking up from our organizations. They also help instill a sense of trust and dignity among our clients, providing them with the same confidence as shopping at a grocery store. And we just really want folks to know that the food that we serve and that they receive is accurately labeled and safe to share with their families. So just be sure to keep an eye out for these major allergens as they make their way through your organizations. Here are some best practices to follow to ensure allergen control at your organization. So store allergenic foods separately from other foods. Use separate cutting boards, utensils, and cooking surfaces for these foods, and that helps prevent cross-contamination. And change those gloves after contact with those foods. Emphasize proper cleaning and sanitizing of all equipment and surfaces that come into contact with allergenic foods. And you'll also want to ensure that all products, including packaged items, are clearly labeled with any allergen information or a general disclaimer. And just remember to regularly inspect food packaging for leaks, spills, or any kind of damage that could lead to cross-contamination. And, with proper handling and labeling, we can avoid cross-contamination and ensure that we're feeding our community safely and keeping those allergens at bay. And then next up, Kelly is going to dive deeper into preventing cross-contamination.
Hey, thank you, Sarah. All right. Yay. So this is a good transition again. You'll notice a lot of these food safety principles really support each other and have a lot of overlapping themes. So I just think it's cool when we can see that coming together. So Preventing cross-contamination is so important, and I wanted to put the definition of cross-contamination on the slide to ensure we're all on the same page. So that is when harmful bacteria, allergens, or other substances, maybe physical or chemical hazards, transfer from one food, surface, or object to another. Um, so cross-contamination and preventing it doesn't just refer to major allergens, but also that no contaminants or hazards cross-contaminate food. So this includes making sure that physical debris such as paper or broken gloves does not contaminate a box of strawberries, or ensuring that raw meat is stored below ready-to-drink milk in case the raw meat leaks fluids onto the milk, or if possible, even storing those two things separately because milk is also an allergen. So practices that will help prevent cross-contamination is to make sure that you're cleaning and sanitizing all surfaces that food touch before placing food on them and after food has been on them. So that's like the table that you pack food on, wipe it down before you start putting food on it. You can clean it in between tasks, and then you can also make sure you clean it at the end so that maybe biological contaminants aren't left on there to kind of fester and grow. Inspect your food packaging and make sure none are leaking or spilling. If something is leaking and spilling, it's going to cross-contaminate your other food, and then it'll all then have to be disposed of. So it's really important to inspect your food packaging, especially if you're putting it away in longer-term storage, like a freezer or a shelf. You don't want to come back, thinking that you have 5 cases of food, only to find that they have had something leak on them and become spoiled. When possible, store food with allergens separate from other food. Dedicate specific storage areas for allergen food when possible. The other way too is to ensure a lot of, it's hard when we have limited cooling space, like fridges and freezers. So try to separate the shelves by like raw meat or raw dairy, or when possible, have separate cooling units for those items. Especially ready to eat foods. Make sure your ready to eat foods are stored on top so that nothing is possibly falling down on them from above and contaminating them. Similar to that, you should never store chemicals above food. They should always be stored separately or on the very bottom shelf so that if something happens to leak or spill, it hopefully will not fall on your food. Remember to wash your hands and change gloves frequently, but always after handling different types of food in particular. And then another great tip to help your facility is color coding is a really great tool, and labeling your storage areas to ensure that food is stored properly and helps prevent cross-contamination. And it also helps when you have different volunteer shifts. It can make it really visually clear where things are supposed to go. So you could use red tags, for example, for like raw meat. You could use yellow tags for dairy. You could use green for produce. And then the tables could have labels on them with that color too. So there's some really cool things you can do to make it easier. There are also some reminder posters and things you can find online about preventing cross-contamination. Right, so I'm going to hand it over to Christy to talk about safe transportation as well as time and temperature control, which are very closely related in the scheme of what the work we're doing.
All right, thanks, Kelly. So yeah, as Kelly said, we're going to continue kind of down the same theme. So all of you, I'm sure at some point, transport food from one location to another. And so whether you're performing grocery rescue or you're picking up your food directly from the SLO Food Bank, or perhaps you purchase food at a grocery store to supplement what you serve in your pantry. And our goal is really to make sure that when we're transporting that food, that we're maintaining cleanliness as well as safe temperatures. And so all vehicles that are transporting food should be clean. They should be free of odors, whether that is smoke or fuel odors. If you happen to have a container for your lawnmower in there, a fuel or something like that, you want it free from odors. You want it free from pests as well as your pets. And then any other materials that could adversely impact your food safety. So a couple things to consider when you're transporting food. That food, especially if you have temperature sensitive foods, perishables, you want to have your vehicle be cool. So prior to getting to wherever you're picking up the food, make sure that you have cooled it down inside your vehicle and then maintain that cool temperature. As we all know, our vehicles heat up rapidly in the summer months. And if you're transporting food in a vehicle that is 80, 85 degrees, your food is rapidly increasing in temperature as well. As much as I love to bring my dog everywhere I go, please, when you are transporting food, please make sure that your vehicle does not include Fido or Fluffy, and also that it is clean and free of what we always refer to as puppy glitter or animal hair, because the last thing you would want is to pull out, some ready-made food and only to find dog hair attached to it. And then going back on what Kelly had referred to about avoiding cross-contamination. Now, we know that grocery rescue is sort of the wild west of getting food out there, so it comes in all different shapes. And so when you get a box of food from the grocery store or from school rescue or even from the food bank, you're encouraged to look at it and see what is in those boxes. And whenever possible, as you're loading your vehicle, keep in mind that cross-contamination advice that Kelly gave, which is never stack raw meat over ready-to-eat foods such as produce. And when you can, do not store common allergens next to other foods. We recognize that space is limited and that you can only do so much, but please do try to keep all of these things in mind. Many of our donors luckily do pack like items together in boxes, so hopefully that helps you out a little bit that way. Then continuing on, with our goal being to manage and maintain safe food temperatures throughout the entire process, from the moment you receive food until the moment you distribute the food. We want to just give you some tips on how to make that a safe activity. So one of the best things you can do is be sure that you're keeping your trips, whether it's from the SLO Food Bank or from one of your donors, back to your pantry under 30 minutes. So that may mean, maybe you don't pick up rescue at 3 stores all at one go. Perhaps you do need to return to your pantry, unload, and then go back out again. Or that, if you live in a Atascadero, maybe you don't drive all the way into SLO to pick up rescue here. So just be very mindful of that, please. Please use passive refrigeration during transport, especially in these warmer summer months. All of you participating in rescue have received thermal blankets, and those should be implemented, as of now. So when you're transporting your food, please cover them. And we've had really good feedback from partners saying that it is really holding those temperatures. And sometimes some of the agencies are actually noticing that temperatures actually drop a little bit when they're tucked in those blankets. When you get back to your pantry with foods, refrigerate or freeze your perishable foods, anything that came from a refrigerator or freezer, immediately upon returning to your pantry. We know that we ask you to sort and weigh foods. So if you are not going to get to that right away, or if you're going to start with boxes of bananas before you get to those boxes of meat, please refrigerate those perishables while they kind of wait in line for that next step in the process. When you are setting up for your distribution, I'm sure sometimes it takes a bit to get everything set up. Please consider covering those perishable foods with a thermal blanket, again, to help maintain that cold temperature. And in these sunny summer months, also remember that when you have your distribution set up and your clientele is coming through, really look at where your tables are and make sure that those temperature sensitive foods are out of the sun and in a cool location. Because we really do want to make sure that everything is handled safely until the moment it leaves your facility. So for those of you involved in food rescue, as you all know, the following policy is a requirement for participation in agency direct rescue. Feeding America requires that all agency partners involved in food rescue measure and document sample temperatures for that donated food at the time of pickup, and again, back at your pantry or delivery site. And I've spoken with all of you personally about this, and I know you all are implementing it and doing a wonderful job. Those of you who are not involved in rescue, this is still a really good best practice for you to start considering. So if you are receiving donations from the public, or if you are purchasing food and bringing it back to your pantry, we would encourage you to at least take temperatures upon returning to the pantry. While not required for you, it really is best practice to understand those temperature fluctuations and how you can best manage that so that you are serving your clientele with the healthiest food and with the most respect. All TCS foods, time and temperature control for safety foods, must be staged, transported, and held at temperatures appropriate to to the relevant food item. So for anything that comes in and out of a refrigerator, it should be maintained at 41 degrees or less. And when you receive frozen foods, those frozen foods should be solid, kind of sounding like a door if you should knock on them. We understand that sometimes things can fluctuate. And so we want to emphasize that this process is a learning curve here, and we are here to support you. One thing that I did want to point out is the temperature log on the lower left side of the screen there. It can be found in the Food Rescue Toolbox on the Food Bank's website. All of you should have already received a copy of that, but for those of you that maybe have run out or you would like to take a look at them, they are there for you to use and print. So what kind of food should be sampled for those of you performing rescue? Anything out of a refrigerator or freezer, but I would emphasize those dairy products, meat products, eggs, and prepared foods. If you have a mixed bag of stuff, mixed boxes of things, those are the ones I would start with. And again, we're only asking you to do a sample temperature. So if you receive a box of, let's say, a crate of milk, and there's 4 or 5 or 6 bottles in that, choose the product that's in the middle of the box, record its temperature, and see how that looks. And if you have any concerns, I would say sample a second one. But at no point are we asking you to sample every single item that you're picking up. Sorry about that. I just lost my place on here. Something's not. Whoop. Oh, okay. Somebody
Sorry,
else
guys.
has.
I was muted. I'm going to
That's
be
okay.
taking over the cleaning and sanitizing slide.
Okay,
Oh,
I
wait,
think I had
where
one
are
more
we?
slide.
Yes,
I
you
know.
did. It's okay. Okay, we're
Sorry
actually
about
going to
that,
talk
everyone.
about evaluating food in the next slide. So as a team, we have the opportunity to define the face of hunger in our community by rejecting the notion that someone experiencing hunger should accept food in any condition. Distributing to the public, we all have the responsibility to provide safe, properly handled, and dignified food. So, some things to look out for before distributing items include signs of spoilage, mishandling, such as rust, small tears in packaging, spills that could be indicated by soggy cardboard or residue on your shelves, large dents in cans, or on your frozen items. Freezer burn can indicate that that product has been thawed and frozen multiple times, which can lead to bacteria. Please look to see if items such as boxes of pasta or bags of rice have been previously opened or partially used. Even if the food looks edible to you, if you're unaware of how the food was handled before distributing, it is not safe to give someone else and should be discarded. Generally, use your best judgment. And then the second part of this slide is about dates. So most food is labeled with a date. This can be a best by date, a use by date, a sell by date. They all mean similar but different things, but a common misconception is that these dates are safety recommendations. They are not. Most foods are still edible after that date passes, but they may have lost some quality or freshness. Again, use your best judgment when distributing food past its date. The SLO Food Bank has some great guidance on all the different types of food and how the certain date can be applied, or how long after that date is the food still likely edible. We can include those links in the follow-up email. And then the last part is to minimize the volume of food passing its expiration. We want to use the first in, first out, or FIFO method. To do this, you want to organize your shelves or your refrigerator with the closest expiration dates closest to the front or in the most accessible space so that they are consumed as quickly as possible. And then next, I'm going to talk about cleaning and sanitizing and some pest control. So as we've touched on, keeping a clean space for storing and preparing food is essential to safely serve our community. We want to avoid bacteria, dirt, and chemicals from contaminating our food. For this reason, you should be using safe cleaning products. Avoid using bleach-based cleaners, drain clearing chemicals, etc. in and around the food preparation and storage areas. Similarly, you should not use homemade cleaners outside of your personal kitchen. Although they may work at home, if it doesn't have a label with the specific ingredients on it, it is not appropriate to use in a space where you're serving the public. Food contact surfaces should be cleaned and sanitized regularly, including after each use, before handling different food types, and after 4 hours of constant use. Additionally, they should be cleaned and sanitized when there's a break in a task or if there's suspicion of contamination. For example, if you walk away from your food prep area to use the bathroom, when you come back, you want to clean that space just in case something has happened while you were away. Within indoor storage areas or prep areas, keep food waste containers such as a compost bin covered for limited risk of contamination. You don't want to have rotted food touch the food that's prepared to eat. Be sure to regularly take out the garbage and clean even the inside of your trash bin on a semi-regular basis. A recommendation or best practice to ensure your space is safe for food handling. You want to create a shared schedule with written expectations for staff and volunteers. This can include various cleaning tasks and a record of when they happen to keep everyone accountable. I'm sure you've all seen this in public bathrooms where the staff checks off when it was last cleaned. Then the next slide is about pest control. Something nobody wants to see in their kitchen is little bugs or vermin. You want to look out for droppings, nests, and damage to products that look like little bite marks or scratches in the packaging. You want to inspect the perimeter inside and outside of the facility to see if there's anywhere where bugs or little animals can get inside. And then if your food is slow moving, check around it. Check like the back of your shelves where cans can get piled up for months. Make sure that nothing is back there with it. And then again, chemicals such as rat poison must be kept away from food to ensure safety. And now I'll pass it back to Kelly.
Thank you, Miriam. Okay, everyone, we're in the home stretch. You kind of do a little shimmy, feel re-energized for the presentation. Just have a couple more topics we're going to cover. So I'm going to talk about repacking, which is when we say repacking, we're referring to food that's received in bulk that must be repacked into manageable quantities for distribution. So some examples we have are a 50-pound bag of rice that is separated into 10 5-pound Ziploc bags, maybe giant cauliflowers that you encounter that really tempted to cut up into smaller pieces to distribute because it was bigger than your head, or repacking a large bag of a frozen product such as frozen chicken cuts into individual pieces. So with that, I'm going to kind of talk about why repacking food is really not allowed for any agency partner nor the SLO Food Bank. I know we might be really tempted because we want to be able to, we're serving a lot of people right now, and we want to be able to, stretch our food as far as possible to make sure everybody can get some food. And while we absolutely share that goal, repacking is not the way for us to reach it. Repacking requires specific infrastructure and food safety measures that neither the SLO Food Bank nor our partners are equipped to do safely and successfully. Some of those things that are required to be a safe and licensed repacking facility is a clean room, and a clean room actually has a very specific definition under the food code. And to my knowledge, well, I know the SLO Food Bank does not have a clean room, although some food banks do and do repacking. And none of our agency partners, to my knowledge, have a clean room under the California Retail Food Guide. So for that reason alone, nobody should be repacking food that we are serving to the public. Other requirements to do this are that only one type of product at a time can be handled in that clean room. The equipment used in the clean room has to be food grade. I was mentioning earlier that the Limited Services Charitable Feeding Operation Act exempted nonprofit operations from a food facility. However, when you move into food repacking, you do need a clean room with that specific definition under the food code. And then the equipment within that room has to be food grade equipment, which is often more expensive because it's meant to be very durable so that it's not accidentally leaving physical contaminants in your food that you're repacking, for example. You would need proper cleaning and sanitization between each repack. And then another really big piece that we would have to do if we were repacking food, you would have to relabel all the repackaged food every single time, every individual unit with an allergen statement, an ingredients list, the quantity of food, the name and address of the repacker, just so anybody consuming that food has as much information as possible in order to make sure they're consuming it safely. So for all these reasons, repacking is really not allowed in the type of work that we're doing. And I just kind of wanted to touch on that because I know that sometimes we get really large donations or large format foods. If that should happen, please reach out to us. You can call the SLO Food Bank main line. We really want to help try to divert that food to an area that can use it. So sometimes larger format food, like number 10 cans or really big bags of rice, we're able to redirect to maybe one of our nonprofit partners who's hosting a meal site, and they can maybe are cooking that quantity of food all at once. As well as we have some nonprofit partners running residential sites where the residents might be able to share that large bag of rice and things like that. And we just really don't want it to go to waste either. So if this is something your organization is frequently encountering and you need some guidance or need some connections about where that food can go, please let us know. Then recalls. So let's talk about what happens when we know that a food has been recalled due to a food safety concern. So the SLO Food Bank does maintain a recall program to ensure that we can recall any food that we distributed in the event of a food recall. And so some of what's included in our plan is really heavily tied to our inventory system and why it's important that agencies keep a really good list of where they're getting food from. So in the event of a recall, you can go back and see, did I possibly, have food that was affected by this? There are a couple different levels of food recalls determined by the FDA, such as class 1, class 2, or class 3, and this depends on the severity. So you might see that in the language about recalls. Yeah, and it's important to remember a recall can affect any food. So it can be donated food, it can be grocery rescue, local markets, and even purchased food from major retailers. Recalls are often determined at the manufacturing or production plant is often where they start. And you'll often find if you begin reading recall notices, it's often due to improper food or something that happened in the distribution that caused this food to become unsafe. So there's just further proof and evidence that we need to be really careful when handling food. The SLO Food Bank will always directly notify any agency partners if we distributed any product that was then recalled. So rest assured, if you receive food on the PWW weekly menu, and if it's ever recalled, you will be immediately notified by us, and we will phone call you and make sure you are informed until we get a hold of you, because that's what we kind of have the most control and knowledge over. But it's important for you all to monitor your own streams of food, such as food rescue, donations, and purchases. And this is why some other topics we've discussed, such as evaluating food when it comes into your facility, not repacking food, and ensuring all food is properly labeled so you can tell where it came from, is really important. I really encourage the food safety lead at your agency, or if your agency has a general email like, info@slofoodbank.org, for example, I would enroll that email in FDA recall alerts, which will include instructions about how to do. The FDA will send out alerts that look like this, and I like them because I find them really straightforward and they contain a lot of relevant information for you to determine pretty quickly if your pantry is affected by that food. So they'll note the product, why it's being recalled, where the product was coming from, and generally what states or what retail stores it was distributed to. They will also include product photos and lot codes that are affected when possible. So I really encourage people to enroll in those so that when they come up, you can quickly scan them to see if it's a product that maybe is in your facility that you need to go either pull out of distribution or recollect. And if you do have food that's affected by the recall notice will also have instructions with what to do, which is generally contacting the manufacturer or possibly the FDA. And in certain cases, sometimes you can even get reimbursed, especially if it was a purchased product. The SLO Food Bank is part of our recall procedure. I review these emails alongside Sarah and Christy, every single one that comes through. And if we determine that it is likely it could have affected an agency partner in our food rescue program, so maybe it's cucumbers that were recalled from all all Sprouts facilities throughout California, we will send that specific email to our food rescue partners who are picking up at Sprouts and say, hey, this really could have affected you. Please check your grocery rescue food. And it's always important to err on the side of caution. If you're unsure and you're not sure if it's affected or not, I would err on the side of caution and dispose of that food and pull it out of distribution. And then it's also important to note that recalls can continue expanding. I think a good example, if you are enrolled in these notifications, is the recent cucumber recall. It just keeps expanding as the FDA and other entities investigate how and where this food was used. So maybe it starts with the recall is on a whole cucumber, and then we find that whole cucumbers from that same farm are also in like deli salads. And then we'll see deli salads be recalled. The SLO Food Bank will notify agency partners of relevant recalls once at the beginning of the recall, but we're not going to continue. Oh, I'm back. Can everybody hear me? Okay. It like briefly booted me out. So we'll include instructions about how you all can enroll in those, and just keep monitoring them. And if you have any questions, please let us know. There's a lot of different interesting recall notices that you'll see. And so I don't want people to think that you're going to be, bombarded with recalls that you're going to have to constantly be throwing away food from your pantry. That's probably not going to be the case, but we do want people to really keep an eye on it, especially as donated food comes through, to make sure it wasn't recalled food that somebody is like, well, I'm getting this out of my pantry, for example. Whew, okay, and our last topic, sub-distribution. So when an agency partner might have too much food that's going to perish before you can distribute it all, what then? So we all share the spirit of never wanting to waste any food that could help someone experiencing food insecurity, even if it's like maybe a surplus for our pantry this week, or you got a big donation of perishables you're not going to move in time. There are still some guidelines rooted in food safety that we would like everybody to follow and be aware of. So the first one is when you're sub-distributing food, it should only be sub-distributed one time. So for example, if agency partner A rescues food from Food for Less and receives 500 pounds of potatoes, and they cannot distribute all 500 pounds, and they give the remainder to agency partner B. Ideally, agency partner B will distribute all the rest of those potatoes, and if they can't, the potatoes should then be composted. The major reason here is for food safety. As we learned earlier, the more food is transported and handled by humans, the more risk that it has to become temperature abused, cross-contaminated, or exposed to something potentially harmful. And if we're moving perishable food items around to like 5 different facilities, it's just becoming less and less food safe. The quality is degrading, and we can't feel super confident that it hasn't become time temperature abused or just has gone through literally too many hands and is no longer safe to distribute. So we really encourage that food is only sub-distributed once after your agency, just to make sure that it gets to someone's home so they can eat it before it perishes and that it's still safe for them to consume. And then food should only be sub-distributed to SLO Food Bank agency partners. Everyone here today is working with an agency partner of the SLO Food Bank. And when nonprofits partner with us, we ensure that we are all upholding the same food safety standards outlined in this webinar. And we can be confident that this generously passed along extra food is also handled appropriately. We also share a mission of donating to our food insecure neighbors, which all of our agency partners do. Many donors, such as grocery stores, as well as donors that the SLO Food Bank works with to provide food to our agency partner, they donate to nonprofits with an understanding that we are going to serve people in need. And we want to ensure that we're honoring the donors' wishes and our shared mission by keeping it in a network that is all working towards that goal. So when you do share food within our network of agency partners and with guidance from the SLO Food Bank, you know that it's going to be handled properly for food safety. You know that it's going to go to people in need. It's going to be distributed for free, and it's going to maintain the donor's intentions in providing this wonderful food to us and make sure that it is going in the intended way when they donated, for example. So it's just a way of making sure we're staying, diligent in maintaining the integrity of our mission and the program. And so lastly, if you are sub-distributing food, please keep a record or a list. You don't have to keep it forever, but in the event of a recall or other food safety hazard, it would be nice if you're able to give whoever you sub-distributed the food to a heads up. Hey, we had this food and I actually just heard it's recalled. I know we shared some with you. Or if say that you share food and it looked fine when you sub-distributed it, but then you still had a little bit in your pantry and you noticed that maybe it was fresh produce that all of a sudden you realize actually has like mites in it or something or bugs, or it's food that you ended up trying and sampling just one product and you're like, oh, this actually doesn't taste good and I think something is wrong with it. We want you to be able to give our network and the person you shared it with a heads up so they can make sure they can evaluate it for food safety as well. Yay, so thank you everyone. We did it. We went through all of these really valuable topics and we really appreciate everyone's time and attention to these matters. And so kind of just a little synopsis again of all the topics we covered that were required in this training and that are also really good. And then as a reminder, we are going to send out in the post-webinar follow-up, this will be recorded, the slides will be available, and we will be sending out these self-certifications. So if you took the training today and you're in this webinar today, you can sign your self-certification and put yourself on the volunteer log for your organization to help keep track of next year when you'll have to come do the training again or re-listen to the webinar to stay refreshed. And we'll be sure to have that in the post follow-up. And then we will include other resources that we discussed, such as instructions on how to enroll in recalls, our sub-distribution agency partner directory. So if you need a list of agency partners that you can share food with, we have a directory for that that has all of our agency partners, including some you may not have heard of if they run private distributions, but they can still accept food, for example. And then the SLO Food Bank staff is willing to do kind of a food safety walkthrough. We're here to help you. So if you have questions about your facility and your food safety practices, and you want to chat in person or have us come to your site and kind of troubleshoot with you and talk through them, we're really happy to do that. And we're also really excited to expand future food safety trainings and go more in depth on certain topics that are really relevant to agency partners, expand and update this training, and just continue to provide resources in hopes that we're making it easier and more accessible for everybody to be food safety forward in our practices. And so with that, would love to open it up to any questions if anybody has some. So you can go ahead and you can post them in the chat if you don't want to unmute, or you can also use the raise hand function, which should be at the top of your toolbar with a little hand icon, or if you just want to come off mute. And if you have any questions, we're happy to talk through those right now.
Kelly, it's Terry.
Hi, Terry.
Hi. You know, back to the pest issue.
Mm-hmm.
Sometimes you have to look at the facility that you're in and make decisions in terms of what it is you'll accept. And with us, that was a very tough decision in terms of stone fruit because of the abundance.
Yeah, that's a great example.
Yeah. That a lot of folks want to donate it. It's readily available in the summer and it's delicious, but the abundance of the fruit creates the abundance of the ants. And,
yes.
It's like we can't handle it. And, it's awkward having a general prohibition that essentially tells everybody, our clients and donators, we can't handle it. It's not a food product that this facility can safely deal with.
Yeah, that's a really good point, Terry, and that is well within any organization's bounds. The SLO Food Bank definitely has had instances with our Glean program, for example. We've had like root veggies. I think we're going to try them again and see if we can do them, but we've had root veggies that come in really just dirty, for example, and if they get some condensation in them in the fridge, that dirt just starts to like run off and it can become really tricky. Or we've also gotten bulk donations of iced produce, and then the ice causes like a safety hazard in our facility, but also it's like melting water, and that water can make other produce too humid. So that's a really good point, Terry. It can be site specific, and it's well within your organization's bounds to just be like, we cannot safely distribute this, and so we don't accept it.
Thanks for the training, by the way. Good job.
Of course. Thank you. Oh, this is a great question in the chat from Lynette. So what do we consider safe cleaners if no bleach for inanimate objects? So like tables and things. That's a really great question, Lynette. So there's kind of two ways you can approach it. There are some food safe cleaners that are alcohol based. And when alcohol evaporates, it leaves behind, it's food safe. So I think it breaks down ultimately into vinegar or something. But when it's used appropriately and when it fully dries, it doesn't leave an unsafe residue. And so we can try and find some more information on that. But I will say alcohol-based food cleaners are generally food safe, and you don't have to like rinse that chemical off afterwards. Same with food grade sanitizers. And so that's something you can look up online. If you search like food grade or food safe cleaners, you can find more information on certain brands. We use alcohol-based ones through Purell that are specifically for food service. And they include like it's really similar to a Clorox wipe. It's just alcohol based instead. So they're still really easy to use. They're not a crazy difference in price. And then if you are using bleach or other cleaners that aren't specifically food safe, you would just want to make sure that you're really rinsing them off, thoroughly drying them, and making sure that all the residues are off prior to putting any food on there. So my first recommendation is to look up food safe cleaners that are probably alcohol based and try to use those on food contact surfaces. But bleach would still be okay for like floors, for example, because food isn't going to be on the floor. But you would want to be mindful if you're using those cleaners anywhere, they're not splashing up onto food and things like that. So that's kind of why we err on the side of only food safe cleaners. But you might be using those cleaners in other areas that aren't directly touching food, for example. It's a good question. Let's see, any other questions that come to mind? Righty. Well, if there are no more questions, I think, oh, I see a hand up, I think from South County People's Kitchen.
Okay, well, in general, what is the length of, if a canned good, let's say vegetables, say sell by, use by, let's just say June 1st, what is and there's no dents in the cans or no leakage, what is the normal, I mean, can you use it for 3 more months, 6 more months? What is the general on that?
Yeah, that's a great question, Nancy. So it varies by product. And so we do have some guidelines on our website that'll kind of break it down by category. So for example, canned tomato products don't last quite as long because the acidity in the tomatoes can sometimes erode like the integrity of the can the longer it's in there, whereas like dry goods and beans, for example, can last a really long time. So we do have a kind of guidance sheet. I also recommend, if you're doing that, let's say you have a case of products like and you realize, oh my gosh, it expired in March and it's like canned goods, you are more than welcome to open one can and inspect the product inside and then even taste test it if everything looks good, just to make sure everything's still looking good in there. And again, if anything's giving you pause when you do that, maybe you discard the entire case. And then there's also an app online through the United States Department of Agriculture called the USDA Food Keeper app. And you can actually search by specific product types and it'll give guidance like, if it's been in your pantry under the right conditions, it's good for, X amount of weeks past its best by date. So it's kind of an imperfect solution right now. When I do food donation sorting shifts, we really just try to look overall and make our best guess. But we also always want to make sure if we're distributing that product that it has a date on it. So even if somebody takes it home, maybe I would eat beans that are 2 months past their best by date, and to be clear, I do. But somebody at home may not want to do that. But when the date is on that food, they can make that independent decision at home. Whereas if it wasn't dated, we wouldn't want to assume that somebody would want that. So I think it's important to just use our best guess and then also the guidance we have, and then be really honest if we are distributing it with people so they can also make that decision at home. But it does vary by product. In general, it can be pretty long. It can be a couple months or up to a year. I also recommend building in a buffer if you're distributing food that's past its best by date. Build in a buffer knowing that it won't stay safe forever. And then we also want people, they may not eat it immediately upon taking it home. So it's important that they're informed as well, or they're able to look up the date. But we can share that guidance that we have. And then the USDA Food Keeper is a really good app. And then Lynette is asking about the protocol for dealing with rodents. Yes, so rodents are really tough. So it's really important if you notice signs of rodents, which is probably going to be droppings or chewing, or you might see signs of activity of nesting. I really recommend calling a professional pest company to come and deal with rodents. They will put out traps and take measures to ensure that they're not coming in. And then you just really want to inspect all your food. I would, for rodents in particular, keep a special eye on anything that they could have chewed through the packaging. So common foods they really gravitate towards are like instant oatmeal. It has paper packaging that they're able to chew through as opposed to like a canned good. Dry grains such as rice and things like that. So carefully inspect all your product. I would recommend pulling shelves out from your facility. So pulling the shelves out, pulling tables out so you can really look at the baseboards. Rodents and ants and other pests love to travel along baseboards, underneath fridges, and sometimes they may even chew through walls. Our pest control person recently told me that a mouse only needs the width of a pinky finger to be able to get through an opening, and that a rat only needs the width of human thumb to get through an opening, which I found disturbing. Apparently their ribs are like mildly flexible. Anyways, so everybody can have the horrible visions I had of that. So you also want to go around and inspect like the interior perimeter for where they might be coming in, as well as the exterior perimeter for where they might be coming in. And then once you identify it, it's just trying to prevent it, maybe removing some of your food for a while or putting it even higher up on shelves so that you have a better lay of the land on the floor and hopefully prevent them from getting in. And then anything that you think may have been contaminated with rodents, you have to dispose the whole thing. So if they chew through one bag of oatmeal and another bag of oatmeal is next to it, I would throw away all of it just because that rodent more than likely was, tiptoeing across the other bag. And we just really want to err on the side of caution and also remove whatever is attracting them as well, until we can get it prevented. So those are some steps you can take. We use Bresden Pest Control, and I know a lot of our other partners do as well. I think Aloha Pest Management is also really prominent in this area. So you can have like a one-time service come out, like one time a year. If you have an ant problem, like heading into the summer, you can set up a recurring schedule for someone to come and spray for ants proactively. And that also really helps in addition to rodents. And then I think we have a question from Craig with the Morro Bay Lions. Hi, Craig.
Hello, good morning. Thank you
Good
for
morning.
doing this.
Of
My
course, thank you for
question is-
attending.
Am I coming through?
Yep.
My question is, if we receive, let's say, 50 pounds of potatoes and onions, and we do not go through those in that week,
Mhm.
do we then dispose of them, even though the following week we would be able to use those?
That's a great question, Craig. Yeah, so if you think the product will last until your next distribution, if you can properly store it until then, which for potatoes and onions, they're both okay outside of refrigeration. They just have to be off the ground. If you think quality-wise they'll make it till next week, you're more than welcome to hang on to them. That's really common, especially with that hardier produce. Sub-distribution is really encouraged if it's the end of your distribution, and let's say you have strawberries and you're just like, oh man, this is an amazing product, but I don't think it's going to last another week, and I would rather somebody eat it rather than it go bad. That's when you would maybe call someone to see, the Morro Bay lines distribute on Monday night. Maybe there's a partner nearby that has a distribution on Tuesday or Wednesday, and they could help get that product out into the community. But if the food's going to last, you are more than welcome to keep it. Or if you have space in your refrigerator to extend the life of that produce and hopefully make it last longer. There are definitely quite a few types of produce that might last longer than a week. And so you're absolutely welcome to keep them if your agency has capacity and will use them again.
Thank you. And then one more question on meat. If we receive meat that is frozen, it is beginning to thaw. You can feel that it is still hard and it has been frozen. Are we still safe?
That's a good question. That one's really, really tough. So if you know where it's coming from, there are a couple of things I would try to ensure that you double check. So the first one would be if you know where it's coming from, I would ask, has this already been previously frozen and thawed? The more times that you freeze and re-thaw meat, the more likely it's going to become unsafe, as well as the quality is also going to decrease. Like the texture of the meat when you cook it is going to get honestly weirder and weirder. So I would definitely check in on that. I would temperature check the meat as well. If it is reading over like 41 degrees Fahrenheit anywhere on the product, it's been thawing a long time. So if the side of the product with maybe an infrared thermometer is reading 50 degrees, I would not dispose of it, or I would dispose of it because you don't know how long it's been out of temp. If it is the best thing would be to distribute it, like immediately get it into cold storage and then distribute it, but also make sure it's going to be within date and tell people when it thawed, because when meat thaws, generally you only have 1 or 2 days to use it, as we know. So those are some things you can take into account. But in general, because it's so hard to tell, why that product was thawing, how long it was thawing, was it thawing intentionally? There are only 3 safe ways to thaw meat, which is in a refrigerator, under cold running water, or in a microwave when it's then directly cooked. So it's really important to make sure they're frozen solid and try to find ways that you can get the product to you frozen solid, because for meat to thaw and the edges to become squishy, it's generally been time temperature abuse to get to that point. And you also don't know if it was thawing under safe conditions. Like, is it thawing because it sat in the hot sun for an hour is different than if it was being intentionally thawed in a fridge, for example.
Kelly, if I
Thank
can
you.
add to that.
Yeah.
If you receive that meat through grocery rescue, I would encourage you to also ask the receiver at the store, because it's possible that they pulled that product from a refrigeration unit prior to arriving, put it in the freezer, and it hasn't dropped to a frozen state yet. And if they can tell you that, then you are reasonably assured that it's been handled properly. It just hasn't had the time to become frozen. And that's where that communication with the stores is really vital.
Yeah, that's a great point, Christy.
Thank you.
Yeah, thank you, Craig. And then, Kevin, I'm so sorry. I had to mute you because there was a lot of feedback, but I think you're on your phone and I can't unmute you now. But if you want to post your question in the chat, we'll be able to see it. Or if you want to call back in, your mic will re-enable. I'm so sorry. That was that was my bad, but I think it was echoing in the background. So if you're calling in, I can't unmute you, but if you recall in or post it in the chat, I'll be able to see your question.
Kelly, could you quickly review what training requirements participation in this session covers?
Yes. Go back. There it is. So this one's going to cover this column. So it will cover volunteers and staff who are participating in agency direct rescue. So they're picking up, transporting, and handling retail food donations. This training covers it, as well as the ServSafe California food handler's license will also cover it. We plan to offer this training every year. So this training is good for 1 year, whereas ServSafe is good for 3 years. This is kind of a newer thing, but this training would also technically cover the lead volunteer / staff member of an agency partner being food safety certified. This will also cover that staff unless you're preparing meals. And then we just strongly encourage anyone regularly volunteering with food to have at least this. This is like a basic food safety training that covered those topics we kept referencing. These are the required topics that we have to cover in this training from Feeding America. So this will satisfy those 2 requirements.
Yeah, and looking forward to you guys sending out the slides, because I can't get the display presentation on my computer.
I'm sorry to hear that, Terry. Yeah, you'll be able to get the slides, and then the recording will be all synced up too, so someone can pause and fast forward and see the slides that we're referencing as we speak.
Great, thanks.
Yeah. Any other questions? Oh, Kevin, yay! Yay, thank you, Kevin. Okay. Yes, great points. The enormous cauliflower. I think I'll let Sarah speak to that first, and then I can answer the question after that.
Thank you, Kelly. Yes, so that came from our Glean program from the Cal Poly Organic Farm. Very large organic cauliflower. I think the volunteers were a little bit excited also when they got out there just to see these like big, beautiful heads. You know, we're trying to rein them in a little bit, trying to get just smaller ones, but they're beautiful. But they're completely organic, certified organic.
Thank you. I know when
Yeah.
those came in, we were like, oh my gosh, they're beautiful, but they're huge. But our volunteers, and I don't blame them, we're so excited. And then they had some of that cool purple coloring, which was really neat. And then, yes, Kevin, for the food safety manager safety training, that is they do talk about only gloves while handling ready to eat food only. So that is one thing where the SLO Food Bank adopts a stricter policy than the retail food code, for instance. And we want folks, because we are distributing so much whole produce, and knowing that whole produce can also be commingled with like canned goods and things like that, we just encourage glove wearing at all times. But you are correct in that in the trainings through ServSafe, they will only talk about gloves being required for ready to eat food. Any other questions? Yeah, I know, I feel like every time. So sometimes, yeah, Kevin is saying that sometimes the glove guidance changes. And so we just kind of adopt wear gloves whenever possible, but especially with ready to eat and whole / raw produce. Well, thank you everyone again. We still have time if anybody has any other questions. But if not, we really appreciate everybody joining us. Please keep an eye out for that post-webinar email that will have all the information. And if there's anything at all that you would like to email us about or call us about, please do not hesitate to reach out to Natalie, to Christy, to Miriam, to myself, to Sarah. We are more than happy to help and make sure we figure out the right person for you to talk to. And we just really appreciate everybody taking the time to be here today and everybody's efforts to ensure that we're serving food safely to our community. Thank you all.